Hi everyone, my name is Adam Baus. I'm with the Office of Health Services Research at the School of Public Health at West Virginia University. We have a few slides today on creating a limited data set using CDEMS. I wanted to acknowledge the leadership and the dedication of the PCDC. Our office really enjoys and values working with you all, and we're glad to do all that we can to help with our partnership along the way. Just for a quick recap, a limited data set is a data set that excludes the following direct identifiers. So it excludes names, postal addresses other than a town, a city, a state, or a zip code. It excludes telephone numbers, fax numbers, emails, social security numbers, medical record numbers, any sort of health plan number or account number, or any other sort of certificate or identifying numbers directly tied to an individual. The only protected health information that is included in a limited CDEMS data set are dates of service and dates of birth. And these are the steps that we'll go through together to create that limited data set. We'll open up the reporting tool, go to the utility tab, we'll click on the output limited data set button, then we'll click on the create limited data button, and then finally we'll click OK to create that data set. So we'll go through those steps together, and then we'll also open up that data file and take a look at the contents together. So my name's Adam Baus. My email is abaus@hsc.wvu.edu. We've been doing a fair amount of web-based support with our partners and also Skype calls. So we're glad to get in touch with you in the best way, and we're very glad to work with you. So I'll jump out of these slides and I'll go over to the CDEMS reporting tool. Okay, here we are. So those steps, you click on the utility tab, output limited data set, create limited data, and it will auto date and stamp the file name based on whatever date and time you create it. We'll click OK, and it says new limited data set created. All right, that is it. So we'll back out of CDEMS, we'll exit and minimize this presentation. So here is the file we just created, CDEMS data demo with today's date, the date of the file, and limited with the day it was created, March the 30th, 2017, at that time. So we'll open it up. So all of the main tables in the registry, the demographics table, health conditions, lab values, measures, medications, services, visits, any socioeconomic indicators being collected, or custom notes. These are the data tables. All of the other tables are simply lookup tables. But these are the tables that have been modified to be only limited data. So we'll open up the demographics table, table demo. You can see now these patient IDs are no longer real. The chart number is no longer real. We have last name, first name, middle, suffix. Date of birth stays as per the limited data set agreement. So all of the addresses, contact information, etc., phone numbers that were recorded in CDEMS have all been stripped out with asterisks, including the primary care provider. And we can see we're left with dates as intended and dates of birth. So that's the demographics table. Health conditions, they're the only identifying information that would have been included in there before would have been a medical record number or a chart number, but those have been stripped out to auto-identifiers now. The same way with the labs. Chart numbers are all gone. Those are now auto-IDs. Measures that were included. Medications. Any services. And we retain our visit dates as intended. And this sample data set didn't have any custom notes, but if there were any there, those would have also been removed. So you can see that what we're left with is a data set that does include dates and dates of birth, and everything else has been stripped out as planned. So as you're interested in learning more about this, or if you have any questions, we're very glad to take those questions. And please keep us in mind if we can do anything to assist along the way. So thank you very much.